Welcome friends to CNS Viewpoint. Like every day at 5 p.m. India time, we connect with you with our thoughts about some issue that has touched us that day. So today we are going to talk about and share our thoughts about the World Bank study which is in newspapers today. This World Bank study, friends, looked at if there was any increase or decrease or any impact on infant mortality, infant deaths during the COVID pandemic year of 2020. So, and this study concluded that around the world, over 267,000, hold your hearts, friends, a very sad news, 267,000 additional infant deaths happened around the world in the year 2020 due to economic downturn of COVID-19. 267,000 additional infant deaths in the year 2020 due to economic downturn. Who is responsible for these deaths? For each life which could have, lived a full life? Who is responsible for these infant deaths? It is not the coronavirus. It is the weak and broken health systems. It is the weak and broken and appalling social security and welfare systems that we have in place in our countries. The worst part for people like me who come from India was to read that the maximum number of deaths country-wise happened in India. Over 99,640 deaths. Over 99,640 deaths out of 267,000 were had taken place in India of infants. Imagine the saddest reality of all. These young, very very young lives, we had deprived them of and devastated their families and loved ones. This is so heart-rending. To even it's so difficult to even digest this kind of information that due to economic downturn we had to lose so many lives, additional lives. We have lost. It's a big loss. It's again another grim reminder why we have to ensure that health security and social security needs to be very very strong for each one of us, not just rich people alone, but also for each one of us. The pandemic has again, hammered the reality that touch one, touch all. My health security is dependent upon yours and each one of you on the planet Earth. And we saw how cases of coronavirus, the first case which probably took place in Wuhan, now the coronavirus has spread from Wuhan all around the world, on every continent, including Antarctica. So I think we need to, this is another reminder why we need stronger health systems, why we need a full spectrum of social security and welfare for each one of us, and especially those who are socially marginalized or come from disadvantaged communities should come first, when it comes to services. We cannot have state-of-the-art health system for the richest of the rich and most powerful among the powerful people, and appalling levels of healthcare for majority of our remaining population. We have seen what such kind of a broken and inequitable health system leads to. But the saddest, another very sad reality is that we don't seem to have learned any lesson. If you look at vaccination rollout, friends, the inequitable rollout of vaccines, where on one hand we have rich nations in America, North America, and rich nations of Europe, etc., and Singapore and others, which have vaccinated over 50, 60, 70% of the population fully vaccinated. But on other hand, we have countries like India, which had vaccinated 8.8% till July 2021, and probably about 10% or so in August 2021. I think the figure has slightly increased. The state I am in had vaccinated 4.3% by July 2021, less than half of the national average in India, which itself is very low. But some states where health systems were stronger, like Kerala, they have vaccinated over 15%, almost double of the national average by July 2021. And now, of course, it must have increased everywhere. We need much faster rates of vaccination. And more importantly, we need equitable way of vaccination rollout. It is not about fully vaccinating the richest of the rich and most powerful of the powerful people, but rather ensuring that the vaccines and every other healthcare services are equitable in rollout. They reach everyone in need. And so this is very important. The other thing I quickly wanted to say was about the World Bank study, which said that it saw an overall increase of infant mortality by 7% around the world during the COVID pandemic year of 2020, and only because of economic downturn. So these 7% more additional deaths of infants occurred not only because of it occurred only because of economic downturn of COVID-19 pandemic. It is not the virus which is killing us. It is our broken systems, our development systems, which have killed us. The inequitable, the injustices which have been there since years and years and decades, and they have only become even more acute and more appalling with every passing year. And the divide between the rich and the poor has also widened every single year. If you look at the Oxfam reports on inequality, so this is very, very alarming. We cannot have a system where 1% of the richest of the rich are enjoying a whole different level of health and social welfare compared to the vast 99% of the remaining people on the planet. And they're not only having a different level of services, but the interests and welfare and the greed of that 1% is also destroying our planet. We do not have a planet B. We do not have a plan B. So you and I, all of us need to rise up to ensure that the development policies of at our level, at every level, should be in line with the development justice framework and rooted into equality, justice, and and where the most marginalized of people should come first. Their interest should come first. We cannot have two levels of services, one for the rich and one for the poor. With these words, friends, hoping sanity prevails, hoping equality becomes a norm and not an inequality history, let us hope, let us keep our hopes alive. We will meet again tomorrow 5 p.m. with our thoughts on another issue which is in our hearts. So till then, all the best. Bye bye. Stay safe.